Are you confused about what you want to do with your life? Are you trying to find a career that you might enjoy? Somewhere where you're trying to help someone? Well, I think I might have the answer for you. Hey y'all, what's up? My name is George and I'm a junior 1 nursing student at the University of San Francisco. Today, we're going to talk about whether you should become a nurse. That, to me, comes down to 5 categories. The 5 categories that I think should be important deciding to be a nurse or not is money, lifestyle, academics, personality and social skills, and work ethic. As a nursing student myself, I've always wanted to go into the medical field. Before I became a nursing student, I've always wanted to become a doctor, and I actually applied a lot to many pre-med programs at many different colleges. But my parents had different plans for me. They didn't want me to become a doctor. I know that's crazy. You wouldn't think that Asian parents wouldn't want you to become a doctor. That's all they want you to do. They want you to have a doctor to your name. But instead, for my parents, they didn't want me to spend 12 years in school and $200, $300 in debt. Instead, I could become a nurse and I'd have to only spend 4 years in college and I'd be down maybe at most $100,000. And for me, it made logically sense because a nurse has great capabilities as a caretaker and they work just as much as a doctor in the hospital. It fulfilled what I wanted to do in the medical field, which is to help others. And what's even great, I didn't even have to spend 12 years in school and I could do what I want on the weekends as a nurse and do what I'm passionate about, whether it's videography or photography. So I made investment into applying to nursing school and I applied to many direct entry and other types of nursing schools. I'll explain in a different video about the different types of nursing schools. When my applications came back, I've gotten acceptances from Dominican University, Azusa Pacific, University of San Francisco, San Jose State, and other numerous nursing schools. But for me, that just came down to the price of the school, how the school was, and if I really liked it or not. For me, at the end, I chose the University of San Francisco, and since I'm a junior now and I'm not transferring out, I think I've made the right choice. Point number 1, money. Nursing is a job that will make you a lot of money, especially in the state of California, but it's also a program that will probably cost you a lot of money, whether you go to a private or public university. I go to University of San Francisco, so it's a private university, and I'm looking around to pay $100,000 for my 4-year tuition and housing, and it's investment for me that I think is considerable because I'm going to be able to make 100 to 150K maybe in the future as a nurse, and I think I can start around 80K in certain areas. And for me, that investment that I'm going to be putting forth and my parents is a great one, and I think that's something you would have to consider, which is whether or not you have the money for private institutions if you want to go into nursing school. If you don't, then there's the public university and the community college route. For there, public universities are always cheaper than private universities, and that means that you'll be paying around 20K or less for nursing schools, such as at San Jose State, depending on what your FAFSA says. And I think that's a really great route for you. And for the community college route, you're very much not paying a lot. You're paying barely anything, a few thousand at most for community college, and at the end you come out with an associate's degree, which as much as it's very great, it's still not the same level as a bachelor's, and I know that some people only want bachelor's when they're hiring nurses, so that's something you will also have to take into consideration. So for tuition, you have many different options. You have the very expensive option, which is private university, which there are a lot of nursing schools which are private, so you'll have an easier chance to go into these schools. And there's a medium option, which is public universities, which are very, very competitive and usually have very lackluster amounts of spots, which means you're going to have high GPAs, high amounts of community services, high test scores to be able to even go into these programs. And then you have the community college option, which is very cheap, comes out with associates though, and still much as competitive as possible. And I think these are all great options for anyone. And money wise, of a salary of a nurse, you're going to be making a lot of money, there's no doubt. Nurses make from a range of $60,000 to $100,000 on average across the United States. And in the state of California, especially in the Bay Area where I'm from and where I am right now, you're going to be making a lot of money. You're going to be making at least $100,000 with 1 to 2 years of experience right out of college. For me, I'm probably not going to have the ability to make as much during my first year after graduation. I'm going to have to probably go somewhere else, maybe outside of California, maybe in certain areas where people don't want to go into California. And that means I'll be able to return back to California with my 1 to 2 years of experience, and I'll at least be making $100,000. That's something you have to consider as a nurse, and I think it's a really, really great job to be stable in the future and to have a great career in. Now to point number 2, lifestyle. Becoming a nurse is really hard and rigorous for a lot of people, and you're gonna have to sacrifice a lot. Personally, for me, I've had to sacrifice a lot of friends, going out and doing a lot of fun stuff for my grades and for making sure that I'm caught up in classes, and also for various exams that I've had to pass. And that's something that you're just gonna have to do, because nursing is a major that requires a lot from you, and it's also a major that tends to kick people out if they're not doing what they need to be. And I'm sure that at many nursing universities, you're gonna have to be tested throughout college to make sure that you're at the level that they want you to be, and that you have to be passing certain curriculums. If you don't, they're gonna give you a couple of chances, and at the end, if you don't pass, you're gonna have to leave the program, and you don't want that. And that means you're gonna have to put your feet down and really sacrifice a lot to study, to practice, and to become a more resourceful student with your time management skills. Something that also is very important is time management. You have to know when you can study, when you can have fun, and when you have to do certain things. But aside from being a student that needs to study a lot, make sure to have fun as a nursing student. It's a tough major, and you're gonna need to have people around you, and you're gonna have to have certain hobbies or certain things that you like to do, whether it's running, whether it's photography, and you're gonna have to rely on them to get you past the hard times in nursing school, because you don't want to burn out and then at the end hate nursing and hate your job, hate your life. You're gonna have to find a way to balance what you love and what you need to do, and then at the end of the day, become the nurse that you set out to be. On to the third point, academics. As a nurse, there's going to be a lot that you need to know, from pharmaceutical information to basic biology to anatomy, physiology to disease processes. There's going to be a lot for you to memorize and to remember. But what's most important in nursing is you don't need to just memorize it. You need to conceptualize it and really understand how these topics work and how they really mechanically operate within the body. Don't just be blatantly memorizing a lot of things. And as a nurse, you have to make sure that you're going to be able to apply it. As much as these are things that you're going to be studying in the textbook or not, you're going to have to apply this to your patients. You're going to have to see it firsthand and know what to do and how you should treat them at the moment, whether you need to give them certain things that the doctors have prescribed, or knowing when to call the doctors themselves. Nursing is a major that requires you to think a lot critically and to really know what you're going to be doing. As for getting into nursing school itself, you're going to have exceptional GPAs, exceptional test scores. The reason is nursing, there's limited spots in most colleges, because nursing requires you to become experienced through physical and clinical rotations, which means you're going to have to be in the hospital itself. Since you have to be in the hospital, there's limited spots around, since you can't be there all the time and having many students running around. On average, a program can probably have around 30 to 100 students, but I'd say around the max is 100 to 150 students. That's due to the limit, and you're gonna have to work your butt off to be able to get into these colleges. And it's gonna be tough trying to have the highest GPAs, the highest test scores, and the highest amounts of extracurriculars, but you're not gonna need to worry about being the best of the best. Nursing also forgives for you not having the highest scores. You don't need to have the scores that can get you into Harvard or stuff like that. You just need to have good solid scores, preferably a 3.6 or above GPA. If you're coming from high school, you're gonna need probably a 1300 or above SAT, probably a 30 and above ACT, and for certain extracurriculars, not having any nursing or any medical extracurriculars in your background could be something that might not be good, but it's something that you don't really necessarily need, but would super much help you if you were to intern at a dental office, at a physical therapy office, or at like a local hospital. That would just certainly add to your academic background for colleges to see and to really make you stand out. In addition to getting to nursing school, you're gonna have to stay in nursing school itself, which means you're gonna have to pass certain exams. For my school, I had to pass an exam called the HESI, which had to be 70% or higher based on the questions that they gave. And if I didn't, I had 2 more tries after that to pass, and if I didn't, I would have to either stay back grade or be kicked out of the program. So something to remember is nursing isn't just about getting in, it's about staying in the program itself and graduating. On to the 4th point. What's most important being a nurse is your social skills. You have to be able to talk to your patients. You have to be able to hold conversations and to make them feel comfortable. You can't be introverted and just talking to certain people or not be able to get out into your comfort zone. Nursing is very much a customer-based job. You're gonna have to do customer representative types of things like caring for the patients, talking to their families, fetching what they need, talking to their physicians, etc. You're gonna need to talk a lot, and you're gonna have to be comfortable doing that. Patients are customers for us nurses, and we need to give them the best care. And to do that, we need to make sure that we make them feel comfortable. We make sure they understand why they're there, what we're doing to them, and what's going to happen during their stay at the hospital. So your personality, I would say as a nurse, you have to be comfortable talking a lot to different types of strangers, being able to hold conversations well, and being able to have fun. Like, the hospital is a pretty dreary place, and as a nurse, you should try to make your patients feel better about where they are. You're trying to make them feel less bad about their diseases or whatever they're going through. You're trying to put a smile on their face, and that's your goal. And I'd say if you have trouble doing that, being a nurse can be quite tough, because it's a job that can be very taxing on you. And if you already don't have the mindset of having fun and trying to get your patients to be happy and comfortable, then it's going to also be more draining on you, because you're going to be going through a lot of what the patients go through. But as a nurse, you should be their rock, and you should be helping them go through what they are going through. On to the 5th and final point of this video, I wanted to talk about work ethic. Nursing is no joke. It's a really grueling and hard program. You're gonna have to work your butt off, and you're not gonna get through it by not studying and just partying all day long. You're gonna actually have to sit down and actually study through the textbook materials and work on those practice problems that your nursing professors give. Really just talk to nurses in the hospitals themselves and really learn from them about what they've done wrong in the past, and as a nursing student themselves. You're gonna have to work to really know what you're doing as a nurse, because as a nursing student, what you're supposed to know is, let's say a patient is hyponatremic. How are you gonna solve this patient's problem? What are you gonna do? Are you gonna call the doctor? Are you gonna put in place what the doctor's ordered? Are you gonna give them more water? Are you gonna give them less water? These are certain things that you're gonna need to know as a nurse, and you're gonna need to know it now. And for that, you're gonna have to study a lot and really understand a lot of things, and that requires a lot of work ethic. You're gonna have to be having a lot of time where you're not gonna be able to hang out with your friends. You're gonna maybe have a lot of sleepless nights. I can tell you so many nights where I've had to stay up just to study for the next test and quiz, which happens every week. It's just something that you're gonna have to go through, and you're gonna have to go through that with your other nursing friends, because you don't go through nursing alone, and it's great to have friends to study with and to work hard at. And I wanted to cover one last topic that should be the most important as a nursing student. It's about initiative and being able to be self-initiative. As a nursing student, nursing professors, nurse preceptors at hospitals, what they want to see is you being initiative and your learning. They want to see you actually go out and offer to do things that you know and you have been trained to do. They want to know that you're working hard and that you're putting your foot down and saying, I'm gonna do this. That's what nurse preceptors really love in a hospital rotation. So if you want to take something away from this video, I really want you to take away that be initiative throughout your whole nursing career. Make sure that you're trying to do as much as you can and trying to apply what you've learned, because you're not only are you going to get practice, but you're also going to get attention of the people above you, the nursing professors, the nursing preceptors, and nursing managers that are maybe even going to be your future colleagues and coworkers in the future. So those were the 5 categories I really wanted to discuss about whether you should become a nurse or not. I think that being a nurse is a great, fulfilling career and it has great benefits, great opportunities, and it's a great paying job on top of all. We're just trying to survive most of the time, and why not have a great job that pays well? And if you do want to become a nurse, there's a lot of things that you could do on top of being a nurse, and you can progress to a nurse practitioner, a nurse anesthetist, a nurse manager. There's a lot of opportunities out there, and being a nurse is just the foundation for it all. I hope that this video was useful and you actually took away something from it. If you did, I'd really appreciate a like or subscribe from you. And if there's anything that I missed or anything that you'd like me to discuss in the future, put it down in the comments below. And until the next video, see y'all.